Welcome to the future inspired by you. I'm your host, Leon Hendrix, part of the Spectrum Health Communications team. We thank you for joining us for the Impact Chat. We will be talking live with the clinicians and leaders behind the innovative advancements made possible by the generosity of you, our donors. Today's topic is advancing the battle against lung cancer with precision technology. Here with us is Dr. Gustavo Cumbo-Nacheli, known to most of us here at Spectrum Health as Dr. Gus. He's the Director of Bronchoscopy and Interventional Pulmonology here at Spectrum Health. Thank you for doing this.
Thank you for having me, Leon.
Sure. We do want to invite our viewers to type questions in the comment section, and we'll answer those throughout this broadcast. To get started, we'd like to share a short video. All right, lung cancer, COPD, you treat serious life-threatening conditions. What can you tell us in layman's terms about interventional pulmonology and what you do?
Interventional pulmonology is a science, is a new branch of medicine in which we perform very minimally invasive procedures. Therefore, we don't make any cuts or opening chests. Therefore, the interventional part. And the pulmonology is the branch, the science that deals with the problems in the lungs, air pipes, and anything that has to do with the respiratory system.
All right. Lung cancer is one of your specialties, obviously. That sends fear through a lot of people to have that kind of diagnosis. Can you tell us how technology has changed, both the treatment and the important part of diagnosing this disease?
Thank you for that. Regrettably, lung cancer is one of those cancers that kills a lot of patients, a lot of Americans every year. It kills more patients than breast, colon, and prostate cancer combined on a yearly basis. And unfortunately, with what we have been doing and practicing medicine, these lung cancers are diagnosed at a late stage. So with the many technological advancements and the support of philanthropy, I'm glad to say that we're able to push back as we have better, sharper, innovative technology to get there sooner and provide patients with curative intent treatments.
We want to get to one of our patient stories now that really shows the incredible nature of the treatment we're doing here at Spectrum Health. Let's hear the story now of David Kidder. To many of us, David Kidder's story is incredible. But is it unique? How often are you seeing cases like his?
We see it more often than we like. When somebody gets diagnosed with a spot or a condition, it's overwhelming the options that are out there. What hospital do I go? What doctor will take care of me? They start looking things up online. We have been doing this at Spectrum Health for a long time. And we have a lot of resources. Some of them have been provided through philanthropy. And David was able to look us up for a second opinion, and they saw that there were minimally invasive approaches with cutting-edge technologies provided through Lemon-Holton Cancer Pavilion. When David calls for an appointment, we bend over backwards to make sure that access is not an issue. So we get the patients there as quick as we can. We see them and we provide them with a detailed, tailored plan for what they need. We consult with other subspecialists, as in surgeons, radiologists, oncologists. And David's case was tricky because the way that he presented, culturally, traditionally, he would have needed 2 or 3 procedures, would have delayed the diagnosis, and likely his treatment would not have been curative. Therefore, the longer it goes for doctors to get to a certain diagnosis and treatment, the more likely is the natural progression of disease is going to hurt a patient. So therefore, having our Lemon-Holton Cancer Pavilion, our lung clinic, having the human resource to buffer patients that are referred, to having the experience and the expertise to collaborate with other specialists, to be able to take a look at each patient that needs our help, and to be able to provide appropriate expeditious care, fast care, get there right away, allows patients to get the treatment sooner than many, many other healthcare systems in the country. Usually the turnaround is between 2 and 6 months for patients in the country to get their cancers addressed. That's the waiting time. At Spectrum Health, we pledge to do that in under a month. From the time that the patient presents to Lemon-Holton, for us to see, come up with an idea of what's going on, get the treatment requires a diagnosis. So we get rapidly to the diagnosis stage. We leverage all the technology. We leverage robotics. We leverage cone beam CT scanning to make sure that we are exactly in the spot that we need to be. And once we have an exact diagnosis and we know to what degree the patient condition may have spread, that's where we already have plenty of opportunity to get them treated within reason. So I'm glad to say that all the resources that have been allocated by the system, all the resources that have been provided by philanthropy, and our human resource that we love West Michigan, we love our community, the communities that we serve, essentially are the reason for us to wake up and go to work. Make us work really hard, get as fast as we can to a diagnosis, and provide our treatment physicians with everything they need to impact lives. We want to change their lives positively, and we do that in a very reasonable period of time, and our patients are extremely grateful for that.
Mm-hmm. And the disease progression is really only one element of it. What about the emotional toll it takes on someone not knowing what their diagnosis is, knowing something's wrong and having to go through all this? Being able to shorten that, I have to imagine, has tremendous psychological and emotional benefits for the patient.
And Leo, you could very well be in healthcare. You're talking about what I referred to, the physical and emotional distress. It takes a toll. Whenever anybody is diagnosed with an ailment or a condition or a disease, it takes a physical for the patient, but emotional toll on the families. Many years ago, when I joined Spectrum Health, my mission was to keep care local. I wanted to provide world-class care right here. We had many, many patients, roughly 10 years ago, that they had to go to other places in the Midwest to get care, to be cared for advanced conditions that we did not have the technology or the human resource to address. I ask all of you to think, what if I get diagnosed with a condition that they have to treat 150 miles away? I have to leave home. I have to have somebody drive me. I have to have them come back. They may not be able to find a place to stay, and all I can do is communicate over the phone. And I'm in a hospital room in a foreign city without being able to see my loved ones. So we pledge with leadership in Spectrum Health and some great leading families in the West Michigan area that we're going to change that we're going to keep every single patient local. And I'm very glad to say that for the past 8 years, we have not had to refer a single patient for having their respiratory, their interventional pulmonary needs met. So with all the help of the community, the support, the trust, with the families that are trusting what we do, nobody has to drive, nobody has to be far from what is that they know best, which is West Michigan, their cities. So patients are okay to travel maybe a few miles from a few neighboring cities to us, but they're not okay to go into Chicago, Cleveland, or Detroit. They want to stay here. This is their home. So we buffer some of the emotional distress. And I like to think that we buffer most of the physical distress. So there's some relief that we see not only in the patients' faces, but also in the family groups. And that gives us a lot of oomph to come back next day for more.
Mm-hmm. How much of an impact do you think that has on outcomes, that the patient is able to stay energized and feel that they can do what they need to do here at home?
Very, very timely questions. There's two quality metrics, and there's two outcomes that we measure. Some of the outcomes are subjective. I feel better. I feel at peace. I feel that I'm contained by my community. I feel that the nursing here understands what I'm going through. They can talk to people that they visit because that's emotional support. It impacts them greatly, subjectively and objectively. Why? We centralize care at Spectrum Health. Our electronic medical records, our specialists, we know among specialists. So to extricate a patient from a community and put them somewhere else, even though in that place for some other specialties may be needed, we offset and we avoid some of that unnecessary trouble for the patient. We cannot find your CAT scan from last month. Well, it's in Grand Rapids. We cannot get a hold of your cardiologist. Well, it's in Grand Rapids. Be able to provide every single specialty care locally offsets a lot of the distress and delays of care from having to explant a patient to put them somewhere else. There's a lot of partnerships that we have established in the West Michigan area, and we are starting to establish other partnerships that are getting farther and farther in Michigan. It has to do with quality care. We provide quality care, we provide compassionate care, and our leadership is very encouraging, and our philanthropists are very supportive in order to keep patients local, provide them with the best care. And the technology, I couldn't ask for any better technology for now. So for the time being, I am extremely pleased with all the support that I have, with all the tools and techniques that we have developed. We have been very active in the world of research. Our patients have been very, very, very allowing us, very willing to engage in all of these innovation approaches. And more and more, I get the feel that we're getting closer to where we need to be.
Mm-hmm. And I imagine you've probably seen this before. I think a number of our viewers may recognize the story from a family member or a friend that's gone through a serious illness, but sometimes the fatigue sets in, and when you're doing all that traveling, wondering what's going on, and you have patients give up. And a lot of times we've seen it where that is the end for that patient because they don't have that fight. Do you think this helps keep that fight alive in them, that you're only coming down the street and the other part of your care is right across the street?
This, to me, has to do with compassion. Patients need to see that their pain and their needs impact others. And that, to me, is the best definition of compassionate care that we at Spectrum Health do really, really well. When patients see that we are interested in what's going on, that we invest resources, that we invest the time, that we spend countless hours researching and collaborating and discussing with other physicians, that type of tailored medicine, that type of personalized medicine gives them a little bit more wind under their wings. They go for one more push, one more day, one more fight. And that's when change is in the air. When they see that one day they're doing better, their pain is not so much, their breathing is a little bit better. and they just start seeing the family members that they see this improvement. And all of a sudden, there we start talking about discharges and going back home. But there was a journey to get there. And it was a journey of effort. It was a journey of rolling up sleeves. It was a journey of learning how to use very, very innovative technology, CAT scanners, robots, different tools that are not even FDA approved, that we're researching and we're trying to find out exactly. We get every day out of our comfort zones because we know that that is what makes our day meaningful. The patient experiencing relief, the families getting the loved one at home. And when we set that goal together as a team and we get that partnership between system, community, philanthropy, physicians, nurses, respiratory therapists, we're stronger together. We're in this together, and I'm extremely proud to be part of this healthcare system, to partner with our philanthropists, and to have a community that is trusting.
Absolutely. We want to share with you another one of our patient stories, a real West Michigan first in how we were able to care for this patient. Her name is Julia Shepard, and she got an innovative treatment, a first of its kind here in West Michigan, to treat her COPD. What an amazing story, and clearly life-changing intervention for Julia. Dr. Gus, can you talk a little bit more about these trials and how much other cutting-edge research and medical advancement we're doing right here at Spectrum Health?
For the past 10 years, there has been a transformation and more realization in the country of the great work that we do and we could do at Spectrum Health. When we pair the human resource, we pair our innovation and the technology, then there's a lot of patients and sponsoring trial companies that want to work with us. This is only one example of a trial that we can do to help somebody that cannot breathe, spends a lot of time in a hospital, and we're able to provide the care in a form of a prospective trial, meaning we recruit patients, they get the intervention, they go home the same day. We have other trials in the arenas of lung cancer, emphysema, bronchitis, and we're glad to say that we're allowing for access, providing them cutting-edge, innovative technologies, and slowly and steadily, we're becoming a beacon for interventional pulmonology in the country.
Wow. We want to give our viewers today some advice, some tips that they can take home with them. You hear these stories, and I think it makes folks ask, what can I be doing to help keep my lungs healthy? Some things obvious, some things maybe not so obvious. What can we take away from this?
Thank you, Leon, for the question. When we think about lungs, we think that that's the only organ, internal organ, that is exposed to the environment. So try not to do anything that will kind of get that organ upset, whether it's getting exposed to some toxic environment, smoking, going into places that it will make you cough and experience shortness of breath. always engage in healthy habits, as in eating healthy and exercising. And importantly, try to stay away from sick people. And unfortunately, we're coming out of a pandemic that has hurt us tremendously. And lungs, unfortunately, are one of those organs that suffer the most.
All right. And that cues up our next question perfectly. COVID-19, we're hearing about some folks who have COVID-19 and get on the other side of it and are back to normal. But some folks are having these lasting impacts that have gone on months beyond their diagnosis. What are you seeing from patients here in West Michigan?
Thank you for the question. In West Michigan, we've seen a lot of patients that, regardless of anything that they try to do, they still get infected. So this is not a self-brought, this is a pandemic. We have doctors that were using protective gear and got infected, but what we can do is get vaccinated. Even though some people are getting vaccinated, we have some that don't, and those can get sick. There's the overwhelming majority of the patients that get COVID-19 diseases, we see recovery. But there's a very, very small part of them that require prolonged care. They require to be hospitalized for long periods of time. And sometimes, what we call the long haulers, they get respiratory failure, breathlessness, and need for assistance for the rest of their life. So everybody should get vaccinated. Everybody should practice healthy habits, wash your hands, use masks if you're not vaccinated. And remember that at Spectrum Health, we strategize and we have a huge amount of resources in order to make our communities healthy and stay healthy, Leon.
Right. And of course, we don't really have any data in terms of years and years after someone gets a COVID-19 diagnosis. Some of the issues that you're seeing, do you believe that they are permanent damage from COVID-19?
I hope not, but unfortunately, by doing this for so long as a medical community, we know that there's going to be some ricochet. There's going to be long-lasting effects. Some of these patients, unfortunately, to be able to be taken care of in their ICUs, they had procedures done that, unfortunately, in the medium or long term, may come back at them. But as part of a system that provides cutting-edge technology, we are very, very creative on ways to go about it and be proactive and provide them with interventions that could either be life-saving or stabilizing their condition. But yeah, unfortunately, I fear that there may be some patients that will need healthcare for a little bit longer than they wish they need to.
Right. When you think about someone's lungs, their ability to breathe, and when that's restricted, I mean, it's life-changing. It's painful. It can really impact a person's quality of life. When you're able to improve that for a patient, what does that feel like for you?
And thank you for that question. It's an emotional question for me. When I was a kid, I grew up with asthma, and I knew how to prepare my own medications, wake up at 3 a.m. being breathless, and it's literally like breathing through a coffee straw. And whenever something relieves that breathlessness and lets you take a deep, fulfilling breath, even though it may not last for long, it gives meaning to life. Then life is not a struggle. Being able to breathe and not be conscious about every breath you take is what I dedicated my life to. And I appreciate the support from Spectrum Health, the support from the donors, as I need help. I need help, and I need help to give back life quality and hopefully be able to provide patients with longer, more meaningful lives. And again, it hits home for me, breathlessness, and I have a problem with breathlessness. I'm going to add it every day. That's why I wake up every morning and think about, well, what am I going to do tomorrow? So there's more to come, and I appreciate everybody's help on this.
And what is the reaction you see from patients when you do these procedures and you saw them and they were struggling to breathe? Sometimes you can visibly see that from the outside, and you see them come back and they're not thinking about their breath. What are the patients saying to you?
The best advice I give to the patients is, you're not alone. I get you through this. I'm confident I have what it takes. I have the system, I have the technology. The sadness of what they went through and the anxiety of what they're gonna come, we need to get them to know that there's a lot of resources and a lot of people that are in their corner. They're not alone. That hopelessness, that sensation of impending doom. Sometimes you take a glove out, you hold their hand and say, you know what, we're gonna get through this. And when they wake up a few hours later, or maybe next day, and they can breathe, they say, it wasn't that bad. I can do this. And then they're ready for the next one. And sometimes it's the first step on a journey, sometimes it's the last step, and then they go home and never see them again. But at the end of the day, that hatchling effect of, okay, I can do this, and thank you. That's what gives life meaning for them and also for me.
I can't imagine what that must feel like when you have a patient, thank you for giving them their life back.
I don't know, it's very humbling. And that's not really why we do it. Oftentimes we go back to those that are no longer around and you say, what could I have done better? What could I do different? And all of those things together, we all need to be better as a community, as a healthcare system, as doctors. And we take the victories, we mourn the ones that left us, but we learn from all of it. So we learn from defeat, we rejoice from our won battles, and we are ready for fighting another day.
Right. Because on one level, we're dealing with diseases, illnesses, lungs, but the most important level we're dealing with is human beings, people.
Some of you that have been helping us have been touched by conditions, and I have been touched by conditions, and family of mine and the community has been struggling. So everybody can help to push back. We don't want to say goodbye too early to anybody, and we want to give them either more time, relief, or at least compassionate care, and this is what we do at Spectrum Health.
Looking forward, what we have going on, what does all this mean for diagnosing and treating lung conditions, not just now, but tomorrow and in the future?
We believe in innovation. I strongly believe that getting out of our comfort zones and exploring what is out there, and that's how somebody saved my life. Somebody thought outside of the box when I was very, very, very young and gave me many, many decades, and I'm paying it forward. So when I wake up, I say, what else can I do? What else can I do better in order to impact positively the lives of the West Michiganders? And the future is very, very bright. We envision a future in which somebody may come to Spectrum Health with a spot in their lungs, and within 24 hours, we can find out what it is, treat it, and the patient gets discharged home cancer-free, back to their families. No lengthy hospital stays, no getting cut open. I envision a future in which we're going to use technology to work our way into areas that are diseased in the lungs and tinker with those in order to repair. I envision a future of stem cell regeneration of lungs, in which patients that may be affected by genetic conditions, they may get very, very forgiving outpatient treatments and go back and enjoy and not have to have this impending doom or appointments and coming back to the hospital and be admitted. So I envision a very, very bright future for our patients that cannot breathe, and I'm working on that every day.
We have a question here from social media. I think it's a good one. This technology that we're talking about, is there a use for it outside of the pulmonology world?
Thank you for that question. We have a lot of ways to go about uses of technology. Technology is a tool. You can go to Home Depot and buy a hammer. What do you do with the hammer? It's up to you. You can do some carpentry. You can do something else. So the tools that we are provided with through system and through philanthropy have many other uses. We are spearheading. We lead in the pack. An example is a robot. We are very fortunate that the robotic technology is first in lungs, but we're exploring ways to use the same platform to be provided to our urologists, patients that have urological problems, prostate, bladder. The robot can potentially do way many more great things than present technology. Another example is for our gastroenterologists, stomach doctors. There's some very specific surgeries that can be prevented, and by the use of the robot, they can do very minimally invasive procedures in the stomachs and even in the esophagus. So whether it's in the world of urology, gastroenterology, GYN, robotic technology can definitely help out, and it's been actively developed. Another great example is cone beam CT technology. In layman's terms, CAT scanner. We were very fortunate to have support to acquire cutting edge. There's nothing better. Cone beam CT scanning, essentially CAT scanner that it's in my room. I can use it all the time, and I can have eyes on the prize always. I know what I'm doing every time with very minimally invasive techniques. And we were fortunate enough to have this piece of equipment in the bronchoscopy suite. Thank you. And we have shared, and we share with our next door neighbors, endoscopy. And there's Dr. Barber, Dr. Solotareski. They have used it to do things that never been done before. Therefore, we have leading imaging industries in the world that they want Spectrum Health to continue using it and to help them develop better ways to do it. So all of those engineers in Germany that are trying to see what else we can do to help, we at Spectrum Health are doing things that have never been done before. So whether it be using a CAT scanner to see inside things that were never seen before, world's first, whether it's to help our urologists to perform safer and shorter procedures, or help patients that have maybe even retained foreign objects in places that otherwise they will need surgery, there's a lot of cross-pollination and there's a lot of uses for all of this technology to provide our patients with nothing but the best.
Surgery, of course, is an important tool that we use, but you talk a lot about preventing surgery.
Correct.
Why is that important?
There's a role, there's a time and a place. I think that surgery, we have to continue heavily leveraging the great surgical resources and surgeons we have at Spectrum Health. For a lot of these conditions, it is the standard of care, meaning for everything that we learn and know about medicine and medical care, we know that surgery is the best way to help patients live better and longer for many years to come. At the same time, it comes at a cost. It comes at a cost of losing a piece of the body, comes at a cost of being cut open, comes at a cost of having to sometimes spend days and weeks in the hospital, and comes at a cost of complications from being cut open. So there's many, many benefits of undergoing surgery when surgery is indicated. What I do is I push the envelope. I want to say, okay, I get it. But what about those patients that cannot undergo surgery? Is it surgery or nothing? Well, there has to be something. And that's where I play a role. And maybe, just maybe, that something could be as good as surgery. So it's always evolving. I live by the fact that necessity is the mother of all inventions. And if you're doing the same thing for 2 or 3 years, you're doing it wrong. The world goes round, our engineers and technologies evolve, our techniques have to be improved, and there is a role of performing minimally invasive procedures to avoid surgery. That doesn't mean that surgery is bad. Surgery is great. I underwent surgery. Surgery saved my life, so I'm indebted to surgeons. But I wish there was something that didn't need surgery when I was 9 and I needed the surgery, as I had to endure a long hospital stay to recover. And maybe if somebody would have came up with something different, then I didn't need to have to be cut open. So again, we're trying to see what works and what doesn't in a minimally invasive way. So appreciation for our surgeons and great work being done by all of us.
And you had a great story before we got started here about a patient at the Children's Hospital where we were able to prevent surgery in a case that could have been very serious.
Unfortunately, we have a lot of these patients that are either toddlers or teenagers that they aspirate. Aspirate meaning getting a piece of something in the lungs. And it's difficult to take it out. It's very difficult to take it out. And for the most part, these patients, when the foreign object is deep-seated in the lung, the conventional tools do not let you reach down there. Do not let you reach down there. So we have developed ways to do rotor routing in the lungs and GPSing and find where these very, very small spots are harboring a foreign object, whether it's a pebble, whether it's a bead, whether it's a crown, or whether it's a 1 centimeter shard of glass that somebody may have inhaled accidentally as they're unconscious. We were able to take that out of the kid. And we did a lot of never done before things with the support of our executives, with the support and full disclosure and consent of to the family, and with the cone beam CT technology and robots. We were able to prevent a surgery, and we appreciate having that technology and having had the experience and the expertise to know how to handle it. We are a center of excellence for robotics and cone beam CT technology. when it comes down to robotics, and when it comes down to cone beam CT, meaning GPSing our way into lungs and finding where we are. We have both designations as centers of excellency, and we have multiple awards and research and trials. Even though surgery could have been indicating that patient, the patient was in such rough shape that they couldn't do surgery. So unfortunately, that could have been a time bomb inside of him. So thanks to our system and thanks to our philanthropies, we were able to help a kid that otherwise may not be around.
And kind of lastly, I'm curious, because you deal with a lot of innovation and helping patients. Tell me about what makes the best day at work for you.
The best day at work is a day that I have no patients. The best day at work is something that all of us as a community, found ways to keep them at home, be able to diagnose them in and out really quick and treat them in and out really quick. That would be the best day for a physician, that there's nobody to care for. But until that day, the best day is getting there early, leaving there late, and make sure that everybody had the best possible care in order to stay at home with families where they belong.
All right. And we know that there's plenty of that work to be done. Dr. Gus, you're a huge part of that. Thank you for sharing your story, and thank you to your patients who were willing to share theirs with us today.
Thank you, Leon, and thank you for all of your work you do.
Sure. And we do want to thank our donors for making this kind of transformative care possible. As we return to in-person events, we'll be taking a break from our monthly Donor Impact series. Look for new episodes of the Impact Chat in the future as we celebrate the programs made possible by you, our donors, to improve health, inspire hope, and save lives.